Hello. September is Suicide Prevention Awareness Month, and the Catholic Charities School-Based Mental Health Team would like to present some facts and information about suicide in order to prevent future incidents amongst our students. Suicide can be a hard topic to talk about, but the more we talk about it, the more we can prevent suicide altogether. Here are some facts and statistics about how suicide affects Black youth. The rate of suicide in Black youth under the age of 13 is approximately 2 times higher than their white peers. In 2008, suicide was the 5th leading cause of death among Black youth, but 10 years later, in 2018, suicide was the 3rd leading cause of death among Black youth. The percentage of Black high school students from 2009 to 2019 has also increased, from people who consider suicide, people who make plans for suicide, and the people who attempt suicide. All in all, the rate is growing. However, the more we know about it, the more we talk about it, then we can do things to prevent it amongst our community.
Hello, I'm here to talk about some myths and facts of suicide. Myth number 1, talking about suicide will encourage someone to act on their thoughts or plant the idea in their head. The fact is, talking about suicide does not increase the risk and may in fact reduce the stress associated with suicidal thoughts. Myth number 2, young people don't actually follow through on suicidal threats. The fact is there has been a 30% increase in suicides among persons aged 12 to 24 in the last decade. In 2018, 27 young people per 100,000 committed suicide. In 2017, there were 62,000 suicides among young people. 17.2% of high school kids had thoughts of suicide, and 7.4% actually attempted. Myth number 3, suicidal people don't give any warning signs. The fact is, 4 out of 5 suicidal persons display at least one warning sign. And myth number 4, young people who say they are suicidal are just trying to get attention. The fact is, most young people who say they are thinking of killing themselves are genuinely having these thoughts. If they are seeking attention, it is because they need the attention, and we can find ways to provide for this need in a healthy way. We should not dismiss their statements.
Hello, so I'm going to be talking about some concerning thoughts and statements and some warning signs that you might notice in yourself or among peers if they are thinking about suicide or considering suicide. So a common one is oftentimes we might say, I'm good, or I'm doing fine, when actually we're not doing good or we're not feeling so great. Some other things you might notice that people might say, or maybe in a text message or on social media, are things such as, I don't want to be here anymore, I'm tired and I feel like giving up, I want to go to sleep forever and never wake up, and I don't want to be in this world anymore. So if you hear any of these things or see them on social media, that's a good time to check in with your friend or tell a trusted adult. Some warning signs with emotions that you might experience or your peers might experience are feeling sad or feeling down, maybe feeling alone and loneliness. You might feel like you can't improve things or things won't get better for you, maybe fearful. You might feel anxious and emptiness or feeling worthless and like people don't care about you or that you're not important in this world. So it's important to note that these things are totally normal to experience, and we all have bad days. Maybe we have a bad couple of days, but if these things go on for more than 2 weeks and you feel like you can't snap out of it, that's when it's time to ask for help. Some behaviors that you might notice, that might signal risk. Could be looking for a way to end their lives, such as searching online or Googling methods related to suicide, maybe withdrawing from activities they used to enjoy. So if they're part of the basketball team and you notice that they no longer go to practice or they're not hanging out with their friends anymore, that's a warning sign. So isolating from family and friends, sleeping too much or not sleeping enough, visiting or calling people to say goodbye, talking about suicide, giving away some of their prized possessions, feeling angry, maybe irritated and sadness, feeling tired and unmotivated, and the use of alcohol or drugs. So some things that we can do when we're having a bad day or maybe experiencing unpleasant emotions is to use our coping skills. So a coping skill is anything that you use to deal with hard times or uncomfortable feelings. So some examples we have on the screen are exercise, writing down things you are grateful for, staying connected and talking to your friends and families and your teachers and any other adults in the building. And this can be in person or maybe giving them a call or FaceTime or chatting them on Instagram. And listening to music is a really great one as well. So with coping skills, it's important to figure out what works for you. There's a ton of coping skills out there. So maybe just trying a few out and figuring out which one works best.
Okay, one of the most important things is to remember who to reach out to. The adults in your life want to know you're never going to be disturbing us. Nothing is too small to share with somebody else. So when you're having these thoughts or you notice these behaviors, please reach out to your school's mental health team. That could be your school social worker or a therapist that's at your school, a trusted adult, including teachers or your godparents, an aunt, just different adults in your life that will show up for you and make sure you're supported. If you're by yourself and you have your cell phone, you can text ACT to 74171, which is a crisis text line, or you can call the National Suicide Prevention Lifeline, which is 1-800-273-8255 or 1-800-273-TALK. Just remember, nothing's too small to reach out about. So we encourage everyone to reach out and encourage your friends to reach out as well. And I hope this information was helpful. If you have any questions, please follow up with an adult at your school and have a great rest of the day.